Welcome to another episode of the DNA of Things, where we explore the intersection of genetics, environment, and behavior, unlocking the potential within each of us. By understanding the intricate layers of our DNA and how they interact with the world around us, we can tap into the full scope of what's possible for our health and well-being and personal growth. Today, I'm thrilled to have Dr. Melvin Martinez Castrillon, a distinguished cardiologist and healthcare innovator. As co-founder and CEO of Gallon, he's transforming healthcare with cutting-edge telehealth solutions, particularly for managing chronic conditions like congestive heart failure. Dr. Martinez Castrillon's mission is to make healthcare more accessible and cost-effective through technology, especially for underserved areas. In our conversation, we dive deep into Dr. Martinez's journey from practicing cardiology to becoming a leader in telemedicine. You'll hear about the groundbreaking developments in telehealth and how his innovations are shaping the future of healthcare delivery, making it possible for patients in remote areas or on cruise ships to receive life-saving care. Today, we explore why these advancements matter and how they're reducing costs and how they're improving patient outcomes across the globe. Dr. Melvin Martinez Castrillon, a distinguished cardiologist and healthcare innovator, particularly known for his contributions in cardiovascular medicine and telehealth. He is the co-founder and CEO of Gallon, that's GAL3N, where he leads efforts in developing next-generation telehealth solutions. Dr. Martinez Castrillon's work focuses on enhancing healthcare accessibility, particularly for chronic conditions like congestive heart failure. So by leveraging technology to reduce costs and improve patient outcomes, this is his mission. His leadership in this area has significantly impacted healthcare delivery, especially in underserved areas. Dr. Melvin, welcome to the DNA of Things.
Jeremy, it's a pleasure. I love the idea of your podcast, and I'm really delighted to be here so we can chat about what you just mentioned, which is my passion.
Well, I love. Thank you, and thank you for saying you love the idea of the podcast, because it was Kara from GeneSeek.ai through Fadi who introduced us. So it's really becoming this very organic community of, I would call them, conscious creators who are working to create a better future. And there seems to be a lot of folks working, at least on this show, I talk to a lot of folks working in healthcare. But your background is, particularly interesting to me. You're as a cardiologist turned tech entrepreneur. I think you're also a triathlete on the side, so no shortage of things to do. I would love to hear Dr. M. I can call you Dr. M for short. Is that okay?
Many and most do. It's either Dr. Mel or Dr. M. Yes.
All right, Dr. M. Well, really interested to understand how you made the pivot into health technology. What were the drivers for you? And as far back as you want to go in terms of, what even motivated or inspired your move into the profession that is the medical profession at large. Love to hear your story, your origins, and how you got to where you are.
How much time do we really got? Listen, it's interesting, at least to those who know, because I kind of have no business being where at the moment I find myself in. And what I mean by that, I was born and raised in the middle of the Caribbean in San Juan, in Puerto Rico, and nobody in my family was in healthcare. And, I guess it comes down to, I was very fortunate to be born to a family that, we were humble. There was not a whole lot of resources or monies, but we were, I don't want to say militant, but we were very into, helping people, into working hard, a lot of religion. And from a very early point in my life, I always wanted to help people. Actually, at the very beginning, when I was still in 7th grade, I wanted to be at some point a priest, just because I thought it was so significant to help others and be able to have where I grew up, the priest was like sort of the mayor and everything in one person, and had such a big. I saw how big of an impact when done right, and I wanted to do that. And then at some point decided, well, no, I guess I like science. I want to be something as equally important to people around me and my community. So I decided to, hey, I'm going to be a doctor. So that was
Wow.
eighth grade, and since then, with what my dad taught me, never give up, and don't ever let not knowing stopping you. Just learn it, figure it out, and move forward. And those two things have driven me all my life, helping people and figuring things out. Is why I'm a triathlete. Is why I have a family. Is why I became a cardiologist. A lot of work, a lot of finishing things. Never give up. And long story short, I was able and fortunate to train and become a cardiologist and become a triathlete as well. And I've been working as a cardiologist for 22 years now. And I see around me the opportunity to keep helping more people in technology. And
Mhm.
I'm being a fan of the idea of really using remote, computers to actually treat people and manage people properly. But it's been stuck. And if it wasn't, honestly, because of the COVID pandemic, all of a sudden everybody was slapped in the face with, we don't have a remote patient management tool. So I guess this is going to be rough. And I don't need to tell you about how bad it was. And it underscored the need for something meaningful, clinical, effective. And that's where the whole idea started. Luckily, the regulatory environment here in the US, when the pandemic hit, uh, dramatically had to change in a matter of a day. The
Mhm.
public health emergency was emitted, and all of a sudden, all of the regulatory confines for telemedicine and telehealth were removed
Mm.
and off to the races. And I said, well, if there is no perfect time, it is now or never. So I started working on the idea of creating something really effective, akin to an in-person visit. And what we're talking about among so many other details is physical exam. You can't
Mhm.
do medicine and practice medicine and diagnose and follow up and correctly treat people and without physical examination, among other many things that we eventually, found their way into the platform of what it is today. And that's why I still see Galen as an extension of my primary mission, which is to treat people. It's just amplified 100 times by actually putting the platform that other clinicians and healthcare providers can use.
That's amazing. So, I mean, I hear you talk about telehealth, and then I hear you talk about Gallon, and I think maybe I certainly would benefit, but even the audience would benefit from, what perhaps were our original understanding or perception of telehealth, then say before COVID, and then now, after COVID. Because one of the things you're saying is, well, we need to be able to give you a physical exam, but it's like telehealth. How is that even possible?
Exactly. Exactly.
Hmm.
That
Hmm.
was the big number one on the notebook uh, piece to actually break. And
Hmm.
that was the basis of our platform. Basically, okay, so how do we do physical exam remotely? There has to be something on
Hmm.
the side of the patient, and then remotely there has to be something that allows your healthcare provider to actually go on with examining you. And then we actually looked at the current state and choices out there as far as what they call digital peripherals. And digital peripherals are medical examination tools, but they're meant to be connected to a computer. And we started there, and we looked at a bunch of them and tested a bunch of them until we found the right ones, for everything from, as you can imagine, properly auscultating using a digital stethoscope, selecting the right one for this particular task was not easy. We went through at least 7 of them from different countries, even. And likewise with the handheld examination camera, I had to be able to give you a sense of depth. So polarized lighting was a must. and the ability to actually adjust was a must. And again, we tested a few, and down the line, obviously the piece at the base of everything, it's a software platform that allows you to actually use them in a way that you don't go crazy opening and closing different software packages on any given computer or iPad. So it had to be seamless. It had to be really simple. The medical staff out there is really busy. They just do not have the bandwidth to be opening and operating anything too complicated on a computer on top of their clinical chores. And so we built the platform from scratch. We tapped a developer and they came through. It took almost a year because these things, despite you want them to move quickly, they don't. For obvious reasons, you want to make sure that everything works, that everything responds the way it's supposed to, that there's no, things that go awry and leave you stranded in the middle of an encounter. And then we added a bunch of other features. So we went through that successfully. And it only took us almost 2 years to actually get to putting all of these ingredients together and having a product that fairly easily, as long as it's next to the patient, and it allows anybody to remotely come in and listen to your heart, listen to your carotid, lungs, whatever you want to auscultate.
Wow, wow, wow.
Um,
So is this like, because you said there's peripheral digital devices, right? So does that mean that there's like, I'm imagining a room where there are all these peripheral digital devices. Is it that the patient has to go to that room, or do they own these peripheral digital devices themselves, or how does the logistics break down?
So the platform and the peripheral devices are loaded onto different products, right? So thinking initially, you cannot just go after everything from the get-go. You got to prioritize, and then you got to make a decision. All right, so where do you want to start? So we decided to start in the elderly because clinical reasons, really. As you age, our anatomy and physiology changes, and so the need to properly arrive at a correct diagnosis and treatment, you have to examine these folks. The older we get, not everybody's hearts sound the same.
Mm-hmm.
Might come as a surprise to many. Everybody has heart murmurs starting at as early as 40, and it simply has to do with just you aging. These are and become part of your particular physiologic signature.
Mm-hmm.
So we started with the elderly. So, all right, so where's the elderly at? Well, nursing home facilities, long-term care facilities, and the like were initially the target for. So a vehicle, a product that is commonly there is a rolling pedestal, like the ones you see on any hospital, for example.
Yeah, yeah.
Put the peripherals there, load the platform with the peripherals in the device. Closely after that, we realized that, hey, if we can actually allow this to move and be mobile, so we decided to load it onto a carrying product. We call it the G-Pod. It's basically a briefcase, and in it, there's everything that you need from the computer to
Wow.
the peripherals. Of
Wow.
course, that took another 6 months finding the right briefcase, tough, watertight, gasketed, so that you can throw it in the water and the thing floats. You can run over it with up to 4,000 pounds in a car and it won't break. Really tough, so that it's out there in the environment and can take a beating and actually still do the mission, complete the mission. And so we have the portable, and that opened up all sorts of home health, which is quickly becoming enormous for obvious reasons. If we can take a lot of the needs to you, it makes so much sense. And not only in access, but talking about access, but cost containment, etc. So we jump on the portable G-Pod. That was our second product. And then quickly figure out that a solution to perform, there are so many places that do procedures that require direct supervision. You need your doc to be next to you to do a procedure. Commonest is probably a stress test. When you get a stress test for your heart to see if everything is okay, you need a cardiologist normally to be standing next to you. Well, it turns out that with synchronous systems using telehealth, you can actually now it's allowable as long as you have the features that our platform has. So we developed this third product called the G Stand, and it's called the G Stand because it's actually everything is aligned in a vertical pole with a multi-jointed arm and an iPad, latest generation G4. So it connects by itself basically, and you can talk to the patient, see the patient, answer questions. And if something were to happen, you're still giving orders, you still auscultate and examine the patient. You're constantly, one of our first modifications for this was actually to play nice with a computer that's generating your electrocardiogram where you're getting the stress test done. And the patient is at the facility where the machine that allows the imaging of your heart happens. But remotely, your cardiologist is actually in his or her office, which has dramatic expediency as far as scheduling tests. So you get your test sooner by your cardiologist is there virtually, but directly supervising your test, and everybody gets what they need. The center actually does even higher volumes of tests because now they have a much tighter control of the scheduling. And so far we're sitting on three products right now. And the commonality, of course, is the platform and the digital peripherals that allow that remote healthcare assessment and evaluation, including physical examination.
That's incredible. It's like you can think about, well, I mean, I long for days where we were more in person, although in terms of, efficiency, the number of meetings or conversations that I can have in a day now are probably, 4 to 10x, depending on, how much energy I have that day compared to, going meeting from meeting people downtown. And don't get me wrong, I think we're always as a humanity going to want in person, but I think about, rural areas, that require access to, regular checkups. I think about, well, global insurance companies, even let's say remote workers like maritime and hospitality industries, because you talked about long-term care, but and hospitals and nursing homes, but even having a device like this where you could get several second opinions done in a single day. I know this is like a general checkup, but do you have any ambitions to move into more of like a specialist diagnostic, or, tell me more about that. Tell me, I guess, number one, how are you seeing it affect your peers' ability in the medical system to provide potentially more and better care? And what are some unique ways where, say, the underserved or folks who wouldn't have access to this, this kind of service, this kind of medical examination, how has that been changing as a result of your, your G cart or G pod?
Well, it's been very, very exciting because as soon as we started showing this and getting this out there in the proper shows, etc., it became obvious that there were so many other applications. By creating points of care that include physical exam, you can redefine literally what's possible in places that you never thought of. One of our clients right now, it's actually the cruise ship industry, one of the biggest software writing platforms out there.
Right.
We're integrating and working on precisely changing just to show, one of the places that we are making a big difference. It completely will change how that doctor on board the cruise ship, for example, and they keep getting bigger and bigger, carry 6,000 people, multiple ICUs, and all of a sudden you will be able to receive care like nothing before, simply because those ICUs on board will work more in like a brick and mortar ER where you have a multitude of specialists ready to be called upon depending on what you have. So you could be in the middle of the ocean or in a remote, beautiful, place, but the healthcare options there might not be suboptimal. And all of a sudden you have the latest from literally any sorts of specialists can potentially come in using our platform
Wow.
then chime in and guide that general practitioner or ER physician that's on board, and also helps them when you're at sea. One of the key questions, depending on the urgency and the severity of the problem, of course, is when you get somebody off, like really 911, and get them, air transported somewhere immediately versus what 90% of the time happens. It's important and urgent, but you still don't know if this patient, you need to get them off immediately or not. And for the industry at large, that represents billions of dollars. And of course, the patients themselves, the passengers and the crew, when they do have an issue, now you have a lot more certainty. You're performing a proper triage with the input of as many specialists that are needed to be brought upon. And that simply doesn't exist. So,
Amazing.
so if everything keeps marching fine, we should be on board by next year, probably the second quarter. And we're doing trials right now. And that's just one. But one big one is, and you mentioned it, is the rural places and remote
Mhm.
places.
Mhm.
Not only is this true for the United States, which we have a massive problem in the United States right now. Rural America is closing hospitals down, closing urgent care facilities. Our staff's availability of staff and medical care in rural America keeps getting worse and worse. And this type of technology has the potential to really make a dent in places that it's simply almost impossible to have a conventional medical staff to properly diagnose and treat. And then you can move that all over the map in terms of other places like a penile institution. Jails out there have a massive problem with finding and securing the proper medical staffing. And these solutions actually offer an alternative that it is significantly much, much more than what they have at the moment.
Wow.
And so those are a few examples in terms of how my peers, any given physician right now needs to know that this is really coming, and that not in a not so distant future, you're going to have probably a hybrid clientele when you walk into your office in the morning. Your 9
Mhm.
a.m. is an in-person patient, and your 9:30 might be somebody in Belize that they moved in, but they're having some issue, and or it's your patient, but they just moved to Belize, and now instead of in person meeting, showing up at your regularly scheduled appointment, now you can actually see them and do your job like we were all trained to do, including your physical exam and electrocardiography. Our device list keeps growing, which is also opening up more places where you can actually, by using the platform, you can tailor to certain problems in the community. For example, we have a pervasive problem with rehospitalizations for people with congestive heart failure. Congestive heart failure, of course, for those who don't know, it's when your heart is not able to actually pump properly. And this is a very, unfortunately, something that keeps getting worse and we're seeing more of, but it's one of the most common reasons people get hospitalized, for example, in the 65 and older category. And so it becomes a financial problem that limits what your insurance purveyor can do or not. Well, by having systems that actually find their way into the populations, even in the remote places, you can do a much better job of keeping this particular population stable.
Yeah.
This is happening remotely. Our GPOT, we're working on this solution right now. We are putting a complete 12-lead electrocardiography system in the portable GPOT. So your remote doctor, cardiologist, perhaps in this case, can do exactly what they do in the office, but you're out there, who knows where, as long as we have obviously the connectivity.
Mhm.
So that's
Wow.
that high altitude, but it gives you an idea of the things that we're actually trying to make happen.
That's amazing. When was the company founded?
Oh, 2013.
2013. Okay.
Yeah.
Wow. Okay. And then, so you were chucking along for 7 years up against all kinds of kind of regulatory blockers, probably, and those just kind of went away as a result of COVID.
Well,
And
we were concerned at the
uh-huh.
beginning because for a
Yeah.
long time nothing was moving because it was impractical, and if the
Yeah.
environment, the regulatory environment, is not there to support the
Right.
investments in time and monies,
Hmm.
then the people that need to buy into the technology won't, because why would I if the government or the insurances are not picking it up? And one of the things that happened after COVID is that the provisions for everything that has to do with telehealth were actually then adopted in a more permanent manner. As of today, they keep adding and green lighting more things to be done remotely using telehealth. And
Wow.
that is fantastic because it's a signal, a very clear signal that the CMS, the federal government, which pays for Medicare, Medicaid, is 100% behind it now. And that signal is key for the decision makers to actually know, hey, they want us to use this. And that's the mechanism that normally the federal government, for example, when they want you to adopt a technology, they will incentivize. And that's what they're doing right now. And that's very good to see. That wasn't a certainty in 2021, 22, for example. And we're glad to see that, the efforts of lobbying, groups like the American Medical Association, for example, has a telemedicine lobbying group that has done exemplary well on this in Washington. And things look very promising for anything that has to do with digital health and remote patient monitoring and telemedicine.
So how many units are in the wild right now?
Oh, not a whole lot. We got a dozen of them out there right now.
Okay.
And we
Hmm.
got a couple of payers that are mid-size. And of
Hmm.
course, what we want to do, of course, is to get this in front of the right people to actually, realize this is possible. One of
Hmm.
the things that our problem right now is that not a whole lot of people know that this is even possible.
Hmm.
And I'm the co-founder, the CEO. I have another two partners. One come from the IT world, of course, which is Brain, and that's our chief technical officer, Brian Wallace, and Chief Chris Cho Kwan is our chief information officer, and he also has a very long background on health IT with Humana for almost 20 years.
Hmm.
And this seemed to be the right combination to actually, build something. I had the idea, but that doesn't mean anything if you don't surround yourself, in my opinion, with the right people. It's smarter to own something at a smaller percentage that actually ended up being meaningful
Hmm.
and owning 90% of something that never went anywhere, even though it was a great idea. So I didn't want to fail on that. So
Hmm.
I looked for almost a year before I found the right people to co-found the company, and there's just the three of us. And and it's been now truly finally a year since we had the products and the platform out there.
Oh, wow.
Yeah, and we're in places that we never thought that we would be.
Hmm.
Uh, so we're excited about that, and hopefully we'll keep showing this technology and platform to those who make the decisions.
Who is the most compelled by your offering right now, among all the people that you're talking to these days?
In terms of clients or segments of healthcare, or
Let's say both.
so in the segments of healthcare, I think that you might have heard this before, the 2030 problem. What that means is that in 6 years, we are going to need twice the amount of monies to actually properly care for the elderly around 70 to 72 years of age. The baby boomers are aging all at the same time. And that's going to be really challenging for the entire healthcare industry to respond to. And therefore, and again, this is the same population where most healthcare dollars are spent. This is the same population that has a combination, usually two or three comorbid conditions, puts them at risk. They truly need the best that we can offer to not only keep the clinical outcomes high or improve them, but at the same time be financially responsible and cost effective so that everybody gets what they need. So it seems like the perfect segment and that is what I look at. I think about, in another 6, 7, 8 years, and Medicare might or might not be financially sound. And what are we going to do with these folks? How are they going to get what they need? Where are they at? And so I think that this is the right platform and effort. And that's one. And then in terms of clients, of course, it would be the people who at the moment care for the elderly
Right.
These big Medicare Advantage, which seems to be the predominating trend from the federal government, adopting more Medicare Advantage systems. And these folks are the folks that would be our targets, basically, to show, hey, I know you guys, it's not easy. Things are getting tougher and tougher in terms of staying viable as a company, as a corporation, because they're private businesses. They're telling the governments, yes, we'll take care of these amount of patients for you. We'll get X amount of dollars, but those amounts keep getting smaller, and they are projected to get even less. And so they need options to still do the job, do it right, and cost contain, so that they stay afloat and they can still provide the services that everybody wants. So that would be our targets, and that would be the ideal population to put this in front of, so that they can then, put it out there and put it to great use.
Do you see a future where this becomes less cost prohibitive and it becomes like a household item one day?
I do. I mean, there's the economy of volume, right? At some point, it's going to kick in. And I think that would be part of that economy. But the truth is that this type of platform, like the one that we have at the moment, we intend to continue to evolve in terms of digital peripherals and features to make it more comprehensive, as far as everybody in the healthcare industry have what they need to do and do it remotely effectively, right? That's the goal. I don't discount other avenues to actually get the digital peripheral devices to anybody's home. Partnership with, FedEx or yes, I mean, these guys are everywhere. Places that in brick and mortar are still out there in the geography, with a density that are conducive to creating a system where we can be there, and then therefore create even more places where you can just walk in and see your doctor. My wife laughed the other day when I noticed that the people from Dollar General, for example, have one of the biggest brick and mortar spread on the United States. Like, I think I read somewhere that no one is further than 3 miles or 6 miles from a Dollar General store. And I'm thinking, what if you put this platform and devices in everywhere, as far as we can, and create an environment where actually you could potentially, get seen by a doctor or chime into that regularly scheduled appointment.
Right.
So the idea is to get healthcare to you wherever you might be, and make that actually really feasible. And I think that will go a very long way to solve our current healthcare access equity problem, the rural access problem.
Yeah.
And we got to think about outside the box, because evidently what we've been doing for 20 years is just not going to cut it. The numbers don't add up, and we have a lot of people getting old really quick, and we got to think ahead. Otherwise, we're going to get caught with our, sort of with our pants down again, but in a much meaningful scale. I want people to be happy, to be healthy, and to achieve what they want, even at a later stage in life. And I think that this is one effort towards that goal.
Do you think so? So we talked about rural care and rural access. We talked about the cruise ship industry. Is this something that becomes a tool to kind of just augment care at like urgent care facilities? Because I think about those places are always backed up, especially in flu season, right? carry some of the load there, or do you think it's strictly more to do like a general checkup? I'm wondering about the balance between urgent care and general care, let's say.
I think it can be effectively used on both.
Mhm.
There's nothing that prevents you from doing a proper, yearly physical with our platform.
Right.
And on the urgent care side, it makes perfect sense. It's sort of what we're doing on the cruise ship industry, on the water,
Right.
even and because it changes the options. Urgent care centers are very interesting to me because they seem to be like a good idea, especially in places where you might not have close by full blown multi-specialty hospital, and you have something that you're not entirely sure if it's something that is not serious versus I need some help right now. You
Right.
don't know exactly. And why is it that the urgent care cannot actually provide the same connection like a bigger hospital? You would have access using platforms like these to subspecialists at the
Right.
closest, perhaps, but not so close, uh, properly medically staffed full hospital. And I see a role there. So yes, I see that it's totally viable to be used that way.
Hmm. And I suppose even pharmacies as well is probably something that you've thought of.
Well, one of the things that our platform has that it's pretty clever, if I may say so, is that I thought, well, look, there's so many people in the current modern, quote unquote, modern healthcare delivery system that needs to interact with the patient, right? From case managers to social workers to
Right.
psychology, pharmacy. They
Right.
want to talk to you a lot, and that's a good thing. So we created the platform works in a way that allows other people to join in, not just a healthcare provider like a doctor. So
Amazing.
you can use the platform to connect your case manager with your nutritionist or your physical therapist, chiming in about, well, yeah, he is capable of standing up and doing X, Y, and Z versus and expedite those evaluations, for example. And when you expedite those, cohesive evaluation, your clinical picture becomes clearer to your provider and you can get care faster and earlier, probably. So we have this way that just like we're talking now, and you send me an invite and I join, our platform has that ability. So you can have somebody be there, another healthcare provider if you like, sure, but you can invite. We also tell our clients, listen, what's a fact now with this type of platform is that language barriers are no longer an issue. You can invite any number of live synchronous translating services into the platform when you're performing your evaluation. So if you are, you're dealing with a patient that doesn't speak any of the languages as a healthcare provider that you speak, you just invite the health, you need the translation. Yeah, we don't speak Chinese. I don't. I would be using a service and I can make that happen. And it becomes, seamless. And again, facilitating the interaction, the evaluation, facilitating what we do, which is to get to the bottom of things and offer you care.
That's amazing. Well, I mean, I can think of dozens of use cases. Actually, this will be an ode to the athlete in you, the triathlete, right? Imagine how the utility of this, for the elite performing athlete who suffers an injury, or the developing athlete, because it's just really another, let's just say, that's another degree of health, right? In terms of optimal performance, let's say, right? And have you thought about that at all? Like collaborating with universities? Yeah, maybe working with, because all athletes are subject to physical in order to get clearance to play. But that kind of lends itself to a athlete centered, patient centered type of model, right? Because they will have their manual therapists, their physical therapists, their nutritionists. Sometimes they're orthopedic surgeons, sometimes they're sports psychologists. So, yeah, any thought on an athlete version of this?
No, you just gave it to me. No, I imagine you can have that half of that team
Yeah.
in one encounter, for example, chiming in. All right, we got to make a decision here, folks, if we're going to let this athlete happen or not, or compete or not.
Yeah.
I can see that happening remotely with your particular specialist.
Mhm.
You're healing from, I don't know, let's think an Achilles tendon that's healing and they want to make the call. They had said yes, but something changed now. Our platform, one of the peripheral devices is a handheld sonographer.
Oh, wow. Okay. Wow.
So you can have this guy's Achilles tendon scoped in Germany and your orthopedic guys in Boston. And he's looking at that density and making, trying to make the call. And, I don't think that exists right now the way we're proposing it with the simplicity and ease, right?
Mhm.
And I think that can be very attractive for elite athletes. I mean, we just, and this is brand new. We don't even have anything but a sign at the moment, but we're talking similar on the water. There's a big private yacht insurer, and they're looking at this as a must, as a
Mhm.
something that should be in their insurance package.
Right.
And if you have if you're blessed with the with having one of these big toys that are very costly, it's a completely different demographic, of course, that we're talking about here. But and you barely have a radio and get me out of here really, really quick device, and that's it for
Mhm.
healthcare on board for you, your family, and crew. It makes no sense. So this particular insurer out of London said, "Well, we're interested. Let's see if we can, help us put something together so that we can actually start moving this as an insurance item, and
Right.
then obviously backing it up with the insurance and whatnot." But again, it's very interesting, where one another place that it's in dire need is these places where they drill remote oil drilling platforms,
Yep.
cargo ships. You mentioned it at some point. They're on the list, and our partner in the C software business, they definitely are looking at this because again, it's there's a story about which is true. There's this group that was heading down to Antarctica, and one of the film crew guys got really sick with something that looked nasty. He wasn't, coding or anything, but though it was nasty. And all of a sudden, it was a ship from the Norwegian Cruise Line family, and they had to make an open call on the nearest ship it was a cruise ship of theirs, and then they ended up actually finding each other in the middle of the southern Atlantic. And from there, after the initial evaluation, they couldn't figure it out either. So they had to actually then turn around and head back north to Argentina. The entire thing took 12 days. And this guy, he made it amazingly, made it. But I'm thinking, I mean, if you had the ability to connect this guy and let the images be reviewed by somebody else, even way remote, wherever we needed a specialist, I'm pretty sure we could have actually figured this out sooner, quicker, without having to tax everybody
Yeah.
and the inconvenience and the time and the cost, and especially the patient.
Yeah.
Um,
Well, it's not just the imaging, right? In that you get remote access in theory anywhere in the world. It is then probably like the cloud storage and crowd solutions effectively that can happen in minutes instead of weeks as a
correct,
result.
correct,
So because I imagine a whole, social professional network, whereas if you are, an expert in, say, a particular area, you would get a notification and say, hey, we need 3 expert opinions or 10 expert opinions, et cetera. I mean, actually, you can even think about applications in the legal system as well. So you talked about in prisons, but also in trials, perhaps in terms of identification, let's say.
So I
So
I I had one owner saw the product, the G-Pod, and call it, "Hey, this is a doc in a box." Well,
there you
kind of,
go.
yeah. So you're
Yeah.
saying, lawyer in a box.
Mhm. Well,
That
maybe
sounds like a joke, but
maybe that's a bit far, but I mean, it's just like something that's very fascinating. It's this perfect storm of events that have, you've turned something catastrophic into something, potentially life-saving, which
Yeah.
goes back to your whole, meaning and purpose. And so how do you feel? You had to choose between a preacher and a doctor. Do you think you made the right choice?
I think so. I guess, I don't know. We'll see at the very end.
Yeah.
But I think I did. I really love what I do, and this is I'm a thinker. That's why I
Mhm.
became a triathlete too. Somebody
Mhm.
said that's impossible, like to do an Ironman,
Mhm.
for example. I was like, is it? Because people have done it. So why is
Let
it
me,
that I can't?
is
You
it
know,
impossible? Let me see if that's true.
really? Let's see.
I love
Let's
it.
break it down. And I've been doing
Yeah,
that all my life, so I very much this is an extension of that.
I love it.
One
So,
one yeah.
mhm. No, no,
Now, I
no, go
wanted to
ahead.
say about connectivity because another very convenient confluence is the fact that low orbit satellites are becoming, it is a thing at
Mhm.
the moment. And another big player, Amazon, is stepping in, launching low orbit satellites to create competition. And the byproduct, of course, is that almost everywhere we have actually potentially will have all over the surface, of the planet will probably have connectivity. So think of other countries, and we have a team actually in the Caribbean trying to and managing actually places where there's absolutely very little in terms of healthcare for the population, uh, you know, outside of the urban core. And so these type of satellites are actually creating the opportunity that we can actually put antennas, and even Starlink just came up with a personal one that's like, like very, very small. And that allows us to send these systems to very remote places where there's very little that they can offer, and then connect their own healthcare providers, the people who are in the urban core. Hey, you guys now are answering these calls, and start meaningfully, diagnosing and treating.
Mhm.
Yeah, you're going to still have people that are going to have to come in, of course, but right now there's absolutely nothing. And, like in Panama, for example, I have a client and very interested. And, he was telling me, look, there's places that they spend 2 days, one day on a mule and then another day on a bus to get to be seen after months of having symptoms if they don't drop dead out there.
Mhm.
Just bluntly, telling me how dire some of these remote places can get in
Mhm.
other countries. And here I am trying to figure this out for them. And it's fantastic. I love it.
Amazing. Amazing. Now, Dr. M, I asked you at the beginning before we started recording, I asked you 3 questions. I said, if this was your last podcast, what is it that you would want to say? That's the spirit that I kind of enter into and into all these conversations. And so, what is that kind of roll up message here? And specifically, who are we talking to?
Whoa. Well, first of all, I would say no, but then I will have to say, keep helping each other, man. Keep helping each other would be my
Mm,
message, and never give up. Never
mm,
give up. That would be the bare bones. I'm signing off
wow.
message. Keep helping
Amazing.
each other and just never give up. If you
Yeah.
don't do any of those two, you do the first and never give up. Something good is bound to happen for you and those around you.
Mhm. So inspiring. And if you could nominate one person on the podcast, who would that be?
Woo. That's a tough one. Well, this being the DNA of things and me being a cardiologist, I will have to say perhaps what's the guy in Duke? Lerner. Let me I don't want to get this name wrong. Andrew, I think it's Andrew Landstrom. This is the guy who was supervising the American Heart Association statement on genetics and cardiac disease. Fascinating stuff from the DNA of things, sort of.
Mm.
If you can get him, that would be fantastic conversation because this
I'll tell.
guy,
I'll tell him you sent me.
he doesn't know me, but I was just thinking, and I read the statement when it came out. I think it was last year now, but still, I was like, whoa. This is
Amazing.
something that needs to get out there, and so we keep learning. We keep learning.
All right, I'll see if I can track him down. Dr. M, how do people find you? So I know that the website is Gallon, GAL3N.com.
Correct.
How else can people find you? Are you on LinkedIn, Twitter? What's the best way for them to get in touch?
Well, the company is in LinkedIn, and I'm in LinkedIn as well. But I'm also there as a cardiologist with my cardiology hat rather than
Right.
But LinkedIn and in the internet, unfortunately or fortunately, everybody has my cell, but
Yeah.
locally at least it seems that way, anyways. But that's okay. I like it that way.
Awesome. All right. Well, I'll put those links in the show notes. Yeah. Dr. Martinez, it was an absolute pleasure having you on the DNA of Things. Thank you so much.
Okay. Thank you, Jeremy. It was a pleasure. It was fun. I appreciate it.
All right. What an inspiring conversation by Dr. Melvin Martinez Castrillon. Today, we learned that technology can bridge the gap between people and healthcare, regardless of location. Dr. Martinez's vision is not just about improving healthcare, but revolutionizing it by making advanced, affordable care accessible to all, whether you're on a remote island, in a rural town, or even aboard a cruise ship. We explored the challenges of modern healthcare and how telehealth is transforming the way care is delivered, providing quicker diagnoses, second opinions, and even life-saving interventions remotely. His message of never giving up and helping each other reminds us that innovation comes from compassion and persistence. If you've been inspired by today's episode, share it with someone who could benefit from these innovations. Together, we can spread the love and bring better healthcare to everyone. Thank you for joining us on the DNA of Things, where we unlock the potential within ourselves and the world around us. Stay tuned for more conversations that will change the way you think about your health and